Hello and welcome to Mini Medicos. Our today's topic is polyhydrominos. So, uh, polyhydrominos is a problem related to the amniotic fluid. Basically, there are two chief abnormalities of amniotic fluid during pregnancy. One is polyhydrominos and second is oligohydrominos. Today we are going to study mainly about polyhydrominos. It is a medical condition that occurs due to excess of amniotic fluid in the amniotic sac. There are mainly two varieties of polyhydrominos. First one is chronic polyhydrominos and second one is acute polyhydrominos. So what actually polyhydrominos is? Polyhydrominos is defined as a state where liquor or amniotic fluid exceeds 15 to 2000 ml. So when the amniotic fluid is more than 1500 to 2000 ml, that condition is known as polyhydrominos. It occur occurrence varies from 1 to 2% of cases. It is more common in multiparous women than in primigravida, and it occur in about 1% of one it occur in 1 in 1000 pregnancies. Etiology. First, what amniotic fluid is? Amniotic fluid is actually the urine of the baby. What happens inside the mother uterus? Baby excrete the urine that form amniotic fluid, and then baby again swallow it. So polyhydrominos will occur if there is increased formation of the urine or if there is some problem with the swallowing. So the various fetal anomalies that leads to the polyhydrominos are anencephaly. So what is anencephaly? In anencephaly, baby's skull vault is not formed. Esophageal or duodenal atresia. If esophagus or duodenum are not formed properly, baby will not be able to swallow the amniotic fluid. That leads to polyhydrominos. Facial cleft or cleft palate also leads to polyhydrominos. Problems related to placenta. Chorioangioma of the placenta, some kind of tumor, leads to excess formation of amniotic fluid. Multiple pregnancies. Polyhydrominos is more common in twin pregnancy. Maternal complications that leads to polyhydrominos are diabetes, cardiac or renal problems in the mother. Clinical types of polyhydrominos, as we earlier discussed, there are two types. First one is chronic type. It is more common, and what it means that polyhydrominos in this type occurs gradually and is not a sudden thing. But in acute polyhydrominos is rare and it occur on the pre-existing chronic variety. Chronic, what are the various symptoms that occur in chronic polyhydrominos? Dyspnea, palpitation, edema of leg. So why dyspnea will happen? See, when there is polyhydrominos, maternal uterus will be more distended. You understand? And this distended uterus will push the diaphragm upwards. So there will be less space for lungs. So this leads to dyspnea. Why edema of legs occur? This enlarged uterus also compress vena cava, decrease venous return from the lower limbs, that leads to leg edema. Okay. various signs that we will see in polyhydramnios are: patient will be in dyspneic state in lying down position, evidence of preeclampsia like edema, hypertension, and proteinuria may be present in the patient. On abdominal examination, when you see the patient with polyhydramnios, how you are going to know clinically that patient has polyhydramnios? On inspection, what you will see? There will be enlarged abdomen. Will be markedly enlarged. The skin of abdomen will be tense, and there will be large stria. On palpation, you will see height of uterus will be more than the period of gestation. Girth of the abdomen at the level of umbilicus will be more than the normal. Also, you will not be able to feel the fetal parts clearly due to the presence of more liquor. On auscultation, fetal heart is difficult to be perceived in the patient with polyhydramnios. What are the various investigations that we do in the patient of polyhydramnios? Firstly, clinically you suspect polyhydramnios. No, you will send the patient for USG, ultrasonography. What will we see in ultrasonography? First of all, we will see the amniotic fluid index. This is the index to see whether polyhydramnios is present or not. So, how we calculate amniotic fluid index? See, suppose this is our uterus. Uh, we divide it into mainly 4 compartments, and in each compartment we measure the deepest pocket of amniotic fluid with the help of ultrasonography. Okay, like in this compartment we got amniotic deepest particle 4 centimeter, like you suppose here we got 5 centimeter, here we got 8 centimeter, and in this compartment we find roughly of 2 centimeter. So then we add all these deep pockets. It will come 4 plus 5 9, 9 plus 2 11, 11 plus 8 19. So 19 centimeter. So this is normal. So if the sum of all 4 quadrant is more than 25 centimeter, then we presume that patient have polyhydramnios. What else we can find on ultrasonography? We can see the lie and presentation of the fetus, and also we can see any congenital malformation if the baby have. What are the various complications of polyhydramnios? Maternal complication. Obviously, more distended is the uterus, more discomfort it will cause to the mother. So, patient may suffer from preeclampsia, malpresentation, premature rupture of membranes, and preterm labor. So why malpresentation occur? Because if liquor is more, baby will not engaged. It will float freely in the amniotic fluid. That will increase the chances of malpresentation. Also, more liquor will cause stretching and distension of the membranes that leads to their premature rupture and also preterm labor. During labor, early rupture of membranes can occur. Cord prolapse can, and it is very dangerous complication. It can lead to intrauterine death of the baby. It increases the chance of operative delivery due to malpresentations. During perpurium, it can lead to subinvolution of the uterus because uterus will be enlarged. There are more chances of subinvolution in polyhydramnios. Increase puerperal morbidity due to infection, increased chances of infection, and blood loss. What are the fetal complications? Fetal death can occur, that is mainly due to prematurity and congenital anomalies. As we studied in its etiology that polyhydramnios, most of the time it is due to the fetal anomalies. Management: we have to relieve the symptoms, we have to find out the cause, and to avoid and deal with the complications. Give supportive therapy to the patient. Bed rest. Treat the associate condition like preeclampsia. Get all the investigation done to exclude the congenital malformation in the fetus. Further management depends upon response to treatment, period of gestation, presence of fetal malformation, and associated complicating factors. If the patient is unresponsive and have 37 week of gestation, we have to do amniocentesis. Know what is amniocentesis? In amniocentesis, we actually withdraw some amniotic fluid from the amniotic cavity with the help of injection. Okay. Also, termination of pregnancy can be done once it crosses the viability period. During labor, usual management is followed. If the uterine contraction becomes sluggish, you can give oxytocin. You have to take care to prevent postpartum hemorrhage. IV methergine can be given. So this was polyhydramnios. We will discuss oligohydramnios in next video. Thanks for watching this video. Like and subscribe Mini Medicos.